to go.
All right, well, I would like to thank you or welcome you to Nashua's COVID-19 Remembrance Ceremony in memorial of those people who have died as a result of COVID-19 and for the families of those who have passed away. We want to open with a opening prayer by Rabbi Spira Savet of Temple Beth Abraham. And I believe Rabbi John is with us.
Thank you. We cannot count the losses from COVID-19 in the past year. We do, of course, count them up. 1 + 1 + 1. The dashboard, bookmarked in our browsers, select, click, refresh again by 4 o'clock today, sort by total and per capita. Add them, yes, for otherwise, how could we wake up into another day of planning for grocery shopping and scenarios? Add them up, we must. But at least today, for this hour, the only number is one. One person who died from COVID-19, each one. One to her family, one to his friends, one to their community. Not an aggregate or even a list of names, but each name, a name I know or you do. Today we remember one by one, not for policy or lessons about how we'll live differently forever after, not for blame, not for so that these will not have died in vain, not for why did they have to, not for if only, well, maybe, not even for a reminder that each day we breathe is precious, each breath with lungs not strangled, just remember, one. I myself have buried Joshua and Kostya and Alexander and Marilyn and Patricia, their son, her husband, their mothers and fathers, her daughter. We have placed the dirt in their graves. He was a little older than my kids. He was a little older than I am. They were my parents' generation. Let their memories be a blessing. And if today we don't take time for all the eulogies they deserve that we should hear about their lives, may their memories be a blessing to those who loved, to those who loved them and those that they loved. And to those of you who do get up each morning and have to look at the numbers and add them up to plan for scenarios, you in public office and in places of care, in the impossible knowledge that another one will die while you work your best. You are blessed. Your work is blessed. You who heal and you who lead, blessed by all their memories. May you be blessed by those we are remembering today and by those who are remembering with us.
Well, thank you, Rabbi, for that prayer and for your reflection. And of course, thank you for everything that you do for Nashua and have been doing for a number of years. We really, really appreciate it. So I want to thank you all for joining us. And of course, the guests we have with us, including Senator Maggie Hassan, Congresswoman Annie Custer. We're also going to be joined by Jeanne Goodman, who's Nashua's public health strategist. She has been working on the city's efforts against COVID-19 full-time. We also have Madison Lightfoot, who's representing today Senator Jeanne Shaheen. Well, the last 10 months have been very difficult for all of us. We've all had to make sacrifices as we work together to fight this pandemic. We've had to miss out on the normal gatherings and celebrations that mark all of our lives and bring us together with the people we love. Birthday parties and graduations, weddings and holiday dinners have all looked very strange since March of last year, if we've held them at all. COVID-19 has been hard for everyone, but it has been even harder for some of our neighbors. Over 1,000 people in the state of New Hampshire have passed away from COVID-19. As of today, that number was 1,076. To try to put that number into a local perspective here in Nashua, the Keefe Auditorium at Elm Street can seat 1,200 people. And here in Nashua, 74 people have died from COVID-19. There were sadly 4 just this past week. These deaths are incredibly sad, and I want to extend my deepest condolences and those of our entire community to the family and friends who have lost someone they care about so much. 70 poor people gone too soon because of this disease. Even with people starting to get vaccinated, even with most vulnerable members of our community getting vaccinated first, that number of people, sadly, will probably get higher. The vaccines do hopefully signal that there is an end in sight, but we can't let our guard down, and there is still a lot of work to be done. Nashua's Public Health Department has been working tirelessly to try to keep Nashua safe from COVID-19 for nearly a year. They have administered thousands of tests for the virus, monitored thousands of contacts, worked with hundreds of people who've been COVID-19 patients, and they are now starting to distribute vaccines in our community. We cannot thank our public health workers enough for their hard work. And of course, we want to thank our city's first responders and frontline healthcare workers who put themselves at risk of exposure every day for the care of others. Everyone already has played a part in keeping Nashua safe by wearing masks and social distancing. We need to keep doing these things alongside the vaccinations to make sure that fewer people are affected by COVID-19. We want to follow the science and keep our friends and our families safe. We also want to get back to something that feels like normal. But we can't forget for these families, the 74, that there is no going back. Someone will be missing the next time they get together for a birthday, a graduation, or a wedding. I want to again offer my deepest condolences to those 74 families. And I offer my hope that our city and our community can become stronger by working together to get through the pandemic. Now I would like to introduce Congresswoman Annie Custer from Concord, who of course represents us very well here in Nashua. When she's down in DC, we're really glad to have her with us.
Thank you so much, Mayor Donches, and I want to thank your whole team for taking charge of this project and bringing us together today. Thank you, Rabbi Spirasavet, for your beautiful and moving words. And I think you're so right to focus on the one today. So much of our time is focused on the aggregate, on the per capita, on how can we stop the next death and the one after that and the one after that. We're certainly rushing to bring the vaccine to every Granite Stater. We're rushing to bring treatments to our hospitals and to our healthcare providers. And we're hoping to provide the support to everyone who is struggling during this pandemic. But today, our thoughts are with the families and the loved ones of more than 1,000 Granite Staters who have lost their lives to COVID-19. This is a tremendous loss, and we've endured this as a nation day after day after day. Words cannot begin to fill the hole that are left in those who have lost a family member, a friend, a loved one, or a community member to this vicious virus. More than 450,000 Americans have died, and more than 26 million people have been infected. These numbers are staggering. We can't even comprehend them day after day, but we cannot lose sight of the individual stories and the lives that these numbers represent. I'm reminded of the tragic story carried by New Hampshire Public Radio about Peter and Dottie Miller, a New Hampshire couple who found themselves separated by the pandemic. In April, Peter described his experience. I want to try to describe what it's like in my nursing home right now. Residents have not been allowed to have any visitors. We've been quarantined in our room for a whole 2 months with no one but staff and our roommates to interact with. The lone exception to the no visitor rule is that a resident can have loved ones present while he is dying. My wife Dottie and I have shared our feelings about this. I told her I would prefer she not be present while I'm dying. I don't want her last memory of me to be how I looked when I was near death, and I don't want her to expose herself to the virus. Sadly, Peter did contract COVID-19 and passed away earlier this year. This story is heartbreaking, but it's sadly all too common. We need to remember the human toll that this virus has taken as we go about our work trying to tackle the virus and end this tragic toll. The physical and health damage left behind by COVID-19 is matched only by the emotional scar that it leaves on all of us. So I join with everyone here today, those across the state and this nation who are grieving the lives of lost family members and communities that have been destroyed by this disease. One of the most important ways we can honor their memory is to work together to end the pandemic. And I want to honor Jeanne and her colleagues and public health workers all across this country. Wearing our masks, getting the vaccine, if we all do our part, we can spare others from the fate that has so tragically taken too many. We need to ensure the equitable distribution of the COVID vaccine. And thank you to the mayor and others who are working to reach those communities that have been hardest hit. Underserved communities, communities of color have been disproportionately hit by this disease. And it's incumbent upon all of us to make sure that we respond and recover from COVID in a way that no one is left behind. We also want to take a moment today to recognize the healthcare workers, the frontline workers who have put themselves and their families at risk during this pandemic. They've risen to the occasion to serve our communities during this crisis, and we cannot thank them enough. This past year has been an enormous challenge, but there is light at the end of the tunnel, and together we will get to the other side. Thank you.
Well, thank you very much, Annie. Very nice remarks. And now I would like to call on Senator, U.S. Senator and former Governor Maggie Hassan, who's a very familiar face around Nashua, and ask for her thoughts.
Well, thank you, Mayor Donches. Thank you and your entire team for everything you have been doing to lead Nashua through this. Rabbi Spirasavet, thank you so much for your opening prayer. It was indeed just exactly the right way for us all to frame this memorial ceremony. To Jane Goodman and everybody in public health, and to my colleagues from federal office, thank you for everything you're doing to try to help our communities, our families, our first responders, our state and our country grapple with the magnitude of this loss. We are here because, of course, last week, New Hampshire reached this heartbreaking milestone of 1,000 COVID-19 deaths. And by now, to I think the mayor's point, we are at about 1,076, and over 70 of those deaths happened in Nashua. And today is the day to remember those we have lost as the individuals who they were, and to remember their families and honor their families' mourning and grief, healing and recovery together. Because of course, for every life we have lost, the ripple effect is extraordinary and ongoing. And throughout the state of New Hampshire, there are people who not only have lost their family members, but who have lost colleagues or people they volunteer with at the community level, or neighbors who they always saw out walking every day. So the impact of this pandemic has been felt at a deeply personal level by all of us. And it has obviously also confronted this country with a level of challenge that we haven't had, at least in my lifetime. And I really think many of us think it's a generation, it's beyond generations in terms of the level of unprecedented challenge and heartache, misery that this pandemic has brought to us. So I thank the rabbi, I thank all of you for taking this moment to think about the individuals who are mourning the loss of a loved one because of COVID-19. To all of you who are struggling right now, whether because you've lost a family member or you're struggling because you're newly unemployed or you're facing mental health challenges that have been brought on by or exacerbated by the pandemic, please know that you're not alone. The impact of this pandemic on all of us, on our spirits, on our mental health, on our physical health, on our finances, on our sense of stability, and our sense of the future is real. And if you feel you need help addressing that, you should reach out for that help because it's something we are all experiencing at different levels, but we are in fact experiencing it. I also want to take a moment as we mourn and remember those we have lost to also thank those who have been fighting so valiantly to prevent the loss of more lives. So to all of our first responders, whether they're in public safety on the front lines or healthcare workers on the front lines, whether you're at a hospital or in a long-term care facility, thank you for everything you have done and continue to do. Thank you for getting up every day, even if you have witnessed loss after loss after loss, to try to prevent the next one. Because you are making a difference, and in fact, you have been saving lives, and you have been preventing other families from having to go through the terrible loss that the families of the 1,076 in New Hampshire are dealing with. We have a long road ahead of us, and I want to echo the remarks of Congresswoman Custer. We have to vaccinate as many people as possible, as quickly as possible. And I know she and Congressman Pappas, along with Senator Shaheen and I, are working as hard as we can to get resources to enable us to do that. We have to remember to continue to make the sacrifices that have been difficult to make, wearing masks, practicing social distancing, having holidays and celebrations where there are only a few of us present, and where Zoom doesn't quite make up for the lack of physical presence of our loved ones. These commitments we are making every day to following public health guidance are commitments that contribute to saving lives. They are commitments that are worth it when you think about the choice before us to fight this pandemic with everything we have, or to let it overrun us. And I just want to thank everybody who has been so vigilant and so committed to doing everything they can to save lives. Finally, I just want to again say to all of the family members who are mourning a loved one, we are thinking of you, we are praying with you. And to the rabbi's point, your loved one is not just one of 1,076 in New Hampshire. They were everything to you. You are grappling with their empty seat at the table. You are grappling with wanting to hear their voice one more time. It is a big hole to carry with you. Just know that your fellow Granite Staters want to support you in this process. And again, to echo the rabbi, may their memory be a blessing. I am quite sure it is. And I hope you find solace in sharing those memories with other people. And over time, those memories will be more likely to cause you to smile than to cry. And that is a good sign of the healing to come. We have much work to do to get through this and heal as a country, and I look forward to doing that with all of you. Thank you all so much. Be safe, be well. I'm going to have to exit now because I have to go vote. But know that we are thinking of you, and to the mayor and to the entire Nashua community, thank you for bringing us all together to share in this moment and to remember and to recommit. Be safe.
Well, thank you, Senator Hassan, for being with us. Now I'd like to introduce Madison Lightfoot, who is representing Senator Jeanne Shaheen.
Thank you, Mayor Donches. Senator Shaheen is unable to join us this afternoon, but she asked that I share the following letter on her behalf. Dear friends, I join you all in spirit as we come together to honor those who have died in the COVID-19 pandemic and reflect on all we have lost in this incredibly challenging year. Thank you to Mayor Donches, the City of Nashua, and all who have played a part in this meaningful tribute. In gathering today, we prove that the many lives lost are so much more than a mere statistic. Those who succumbed to COVID were loyal family, devoted friends, and caring neighbors. They were teachers, coaches, city employees, first responders, proud veterans, and engaged members of their communities. Pausing to remember and reflect on their stories is an essential part of the healing process. It will also show how we will emerge from this awful pandemic by coming together with a shared purpose and a shared understanding that many have experienced terrible loss in the past year. I hope we move forward in this same spirit of unity. COVID may force us to remain distanced, but that does not mean we have to be alone. Thank you to the City of Nashua for coming together today to honor, to remember, and to grieve the family and friends who we have lost. Sincerely, Jeanne Shaheen, United States Senator. Thank you.
Thank you, Madison. Well, now I want to introduce Jane Goodman of Nashua Public Health. All of our public health employees, our nurses, have been working 7 days a week for a year now, working with all the people who have contracted COVID-19. I know what a good job they've done from a personal perspective because both my wife and I had COVID and we received periodic calls from public health, and thank you for your help then, and thank you for your help to all of the thousands of people in Nashua who have contracted COVID-19. So with that, I will give you Jane Goodman.
Thank you, Mayor Donches, and thank you, Congressman Custer and Hassan and Mr. Shaheen and Rabbi John, of course. I feel very privileged to speak on behalf of the division director.
Now we have, there's a little distortion in your voice, or, with the transmission. I don't know if there's anything that can be done there or not. But just go ahead,
Is it the Darth Vader voice?
Yes.
Oh, no. I'm really sorry. I would have to log out and log back in.
Well, why don't you go ahead?
Okay. Well, that will change the somberness, but as we gather today to remember loved ones that have left us, it is a time of sadness and also of reflection. Reflections of the time spent together, laughing, praying, playing, and just being. In our work, we've had the opportunity to be in intimate spaces with families as we learned of their loved ones. And it has been with compassion and true caring that we have listened, offered up our sympathies, and grieved with these families. We are here together to mourn the losses with you, honor their memories, and to also hope for a time of brighter days. On this day of remembrance, I'm here to share the reflections of my colleagues at the Division of Public Health and Community Services. The people who have lost their lives and the families and communities that have suffered will have their stories of loss and strength passed down from generation to generation. The hardship, resilience, and hope shown by our communities today will be forever remembered by history and is changing the world as we know it. This has been really hard for all of our families to have critically ill family members in the hospital, and they are unable to visit or offer comfort to them directly. I have found it very difficult to call contacts and have them say that dad, mom, grandma are in the hospital and they feel lost and unable to connect with them. They were worried about them dying alone, and personally found this very difficult to be able to realities of COVID interjecting into one life. I apologize. They were worried about them dying alone. I personally found this difficult in April, and my sister and her husband were hospitalized with COVID in Rochester, New York, in 2 different hospitals. I could not visit, and my only contact was once a day call from a different provider giving me an update. Thankfully, our outcome was good, but for many it wasn't. We need to support the families. Sometimes there are no words that can be said that bring any solace. We do want you to know we are here for you and hope this brings comfort in knowing we all care. Guilt that I have landed a job that I love because of a pandemic. Pride that I get to help so many. Sadness when I speak to a family in distress, knowing that even one death is too many. Wishing I had better news for their calls. Hopeful that illness and deaths will diminish. Admiration for the strength, efforts, and the unity of Nashua. And finally, working in public health during the past year has been eye-opening. Just like many others, COVID-19 has affected many aspects of my life. Part of me will never be the same as I grieve for those that have lost their lives, those that have battled with the severe illness, and the loved ones of those who have passed. Nashua is a strong community, and we must be kind and patient with one another during this time. As I write this with a heavy heart, I also write this with hope. We will get through this, but we must do it together.
All right, well, thank you, Jane, and thank you for all of your hard work at Nashua Public Health. And I want to thank, of course, Senator Hassan, Congresswoman Custer, Senator Shaheen, and everybody who's on the remembrance ceremony and is sharing this, and of course, Rabbi Jeanne for his wonderful and very thoughtful prayer at the beginning. So next we have Nashua Cable TV. Jeff Ponert is going to play Amazing Grace with some video along with it, and that will close our ceremony. So again, we reach out to the families who have lost family members, and we just give you our deepest condolences. So Jeff, why don't you go ahead?
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see. 'Twas grace that taught my heart to fear and raise my fears relief. How preciously that grace appeared. I
Okay, we are off the air.
All right, thank you all for coming.